Welcome to the Business Growth Spotlight, where we shine the light and talk with business leaders from all over the world who are here sharing their expertise and wisdom so we can all grow together. I'm your host, Heidi Schalk, co-founder of HLH Growth Solutions, where we help businesses grow revenue using automated systems and visibility strategies. If you're new to the podcast, welcome. I'm excited to have you here. You're in for a real treat today. And without further ado, I want to introduce my special guest today, Emily Bernstein with Wheelhouse Health Navigation Services. So welcome, Emily, to the podcast.
Thanks so much for having me, Heidi. I really appreciate the opportunity.
I appreciate your time, and I know you're in the middle of a snowstorm, so I appreciate you being here with me today. Emily, can you start us off by telling us about yourself, about Wheelhouse Health Navigation Services, and your role within it?
Absolutely. So I started my business back in about 2019 when I got the idea after my mom was diagnosed with a lymphoma in the brain. So she went through quite the health journey, which we are still ongoing, 6, 7 years later. But we have come a long way and I learned a lot. And so I really wanted to share that experience with other people. So I founded my business to bring health navigation guidance to people who are, newcomers or less familiar or just confused, like most of the population. I think everybody has a story about getting a bill denied or fighting with an insurance company over an approval. And so I am here to help you walk through those scenarios with some expertise and a lot of background that can help with the process. So my goal is always to take the stress off of your shoulders. I think our healthcare system it puts burdens on people that are undue and should not be something they have to deal with while they're focusing on getting well. You shouldn't have to come out of the hospital and then immediately be fearful of going to your mailbox, of getting a bill in the mail and not knowing what it's going to say. Anyway, so that's why I started my business. I focus on billing advocacy. So I do a lot of insurance appeals, denials, fixing errors. There's a shocking amount of errors on medical bills these days. And I do it's a very wide range of services that I provide. So really anything, logistical, navigational with getting the care that you need. That's what I can help with. And a lot of times having an advocate come in and help, people don't know that that's an option, but it is a huge help because not only, like I said, it takes the burden off your shoulders, but it puts a third party involved, which takes the emotion out of it. And it can become a lot more of an efficient process.
Yeah. Well, I'm really sorry to hear about your mom, first of all. And I hope she's doing well. I know I can only imagine the journey for her and for you.
Yeah, it's been I was actually back so she's in Michigan and I'm in Rhode Island. So I was back there last week. She went back in the hospital with an infection and it's just ongoing, as we all know. So yeah, but she's okay now. Thank you for asking.
Oh, absolutely. So, and I can imagine that the people that you work with, and I'm glad you're doing this, and advocacy or support is so important because this is a scary time. People are already dealing with a lot. They're dealing with, fear. They're dealing with the unknown, maybe not understanding it for a lot of different illnesses. Even the doctors, I know for me personally, I'm going through something, even the doctors are like, it's rare and we don't fully understand it or know about it. So for them to know that or find out that there's support out there is really, really just, I'm sure. So people are so grateful. So I want to talk about patient advocacy because it's still really relatively unfamiliar to many people. So how do you define what a patient advocate actually does? And can you share with it what they do in simple terms so we can all fully understand it?
Absolutely. Yeah. So it is a growing industry. There are a lot of us out there. So I am actually a board certified patient advocate, which means there is a board that kind of oversees the training and the certification and the credentialing of advocates. So there is some structure to the industry, which is really great. And they're an awesome organization they're constantly adapting with the times, which is awesome. I think the general theory and the consensus among advocates is, you have an accountant to manage your bills. You have a trainer to manage your physical fitness. You have a lawyer to manage your legal issues. you should have an advocate to manage your health issues. So, it would be great if everybody knew this existed and had somebody in their back pocket to call when they don't know how to navigate whatever the question may be. And like I said, it's such a range of situations that can come up, but when you're being confronted by an injustice from the healthcare system. A lot of us, like I said, have stories and have been there. And so whenever you're faced with this situation where you've waited on hold for 5 hours and you've made all these phone calls and you've done your best and you have no idea where to go, don't give in. Find help and get an advocate, because we can get you out of that hole. I've saved over $1 million in medical debt at this point. So I've eliminated, I think I'm at 1.3 million in medical debt eliminated. I've gotten authorizations for prescriptions that people thought they would never have in their hands. I've helped people get on transplant lists. I've helped people get wheelchairs and other equipment that they need in their hands. And like I said, all of these seemed, impossible by themselves. And with the experience and the help of a third party, sometimes it just becomes a lot more of an efficient process.
Yeah. So let's talk about not knowing, because a lot of patients and families don't even realize that you exist.
Yes.
Right. So how are people finding you? Where should they go to even start this process?
Yeah, great question. So there are some really great directories out there. So there's been organizations popping up that are solely meant to connect people to advocates. Greater National Advocates is a huge organization that has really kicked off that process. So GNA.org or GNAnow.org is a really great option. And then there are actually services that are reimbursable by Medicare now. And so if you're on Medicare, you may be able to get advocacy for free. So check out Umbra Advocacy. They are a really awesome organization that are helping people get connected. And then other than that, I work with a ton of people from across the country. It's been a lot of word of mouth, but it is spreading. And you can find me, my website, my Instagram, my LinkedIn. We're definitely taking advocacy projects, and we're ready to jump in.
So should anybody be reaching out if they're receiving a medical bill, or is it only for people at a certain stage in their medical journey?
That's a great question. It really is up to you, because it's shocking how many people I get where the bill is, $800, which is a lot to a lot of people, but relatively not a lot compared to some of the bills I've seen. But even if it's $800 and you're being charged wrongly, people want to fight that on principle. And I love those cases. I love when people are standing up and they're like, no, this is not something that I should be being charged. Let's fix this. But I've also seen cases where, the bill is $1.2 million and they just have no idea what to do. And so it's a wide range. And even if it's not a bill, like I said, I help people get authorizations to go back to work. I help people apply for benefits, get into clinical trials, like all of those kinds of things, anything logistical that you just are faced with a wall and don't know how to go forward. That's where we can come in.
And you mentioned transplant lists, which are great. That's a great thing, because a lot of people are like denied, or they're, they don't know even where to begin.
Really hard.
So when we think of advocate, we think about, just the bills. But if you are wanting a certain type of care, or you need a certain type of care and you're not getting it, then reach out to an advocate. Go reach out to, to Emily, or go to these websites that can share with you, if you want somebody in your area or a specific, space. So educating people, the public, about patient advocacy is a core part of your mission, Emily. What are the biggest misconceptions people have about advocates?
That's a great question. I think people assume it costs too much, or that it's a kind of a scam service. I've gotten a lot of people that are questioning, how did you find me? And caregivers that are understandably worried about it. But it is we are all HIPAA qualified, so we follow HIPAA guidelines. We're all there to help, and it's a unique service because we can cross the lines between hospitals, between therapists, between insurance companies. Whereas if you get an advocate through a hospital, which does exist, that's an industry that's existed for a long time, but they're beholden to the hospital policies. So I do think a misconception, like there's confusion about what's the difference between, my caseworker at the hospital or my caseworker at insurance and a private independent patient advocate. And so that's one thing that we're able to do is if the hospital is misbilling you, somebody at the hospital isn't really going to be able to push back too much, and they're not going to fight as hard as I would for you to get the balance that you deserve. And then I think we're also, there's sometimes a reputation that we're just like if you know what I
Yeah.
mean? Like we're the
Yeah.
people that walk into a room and just complain about everything that's being done, but really what we're doing is fighting for the individual. Sometimes we're the only voice that is able to do that and to push back and say no. So there's a lot. I mean, it's just such a valuable person to have on your team when you're going through something like this. It's just really crucial, I think.
And you brought up some really interesting information and points around who your advocate is. Like if you're getting through the hospital, not to say that's bad, but you've got to understand who they are beholden to. Like you said, who are they really fighting for? Yes, they want to, they have they obviously need to support you, but at the end of the day, their job is with the hospital. So whose needs are they really prioritizing? Whereas someone like you, who's outside of the system, really the number one goal is for that patient, obviously under the guidelines and rules and the limits of what you can get for them. But you're going to fight for more, and you know where that wiggle room is. And something that somebody comes back to them and says, the patient might be like, oh, okay, I have no choice, where you're like, no, they're this, and this, and we're going to go back and resubmit this. Question for you when it comes to the advancements and the complexity of where healthcare has become. So with technology, insurance, specialist networks, and rising costs, how does patient advocacy evolve to meet those challenges?
That's a great question. And one thing I wanted to say too, kind of in reference to your last point, was there's a ton of advocates out there, and everybody has different specialties. So it is important to know what you're looking for. And sometimes having a care manager in the hospital is the best option, because they're really skilled at, transferring you to another facility and getting you into the next steps of your care. That kind of thing is really important. In terms of the evolving course of healthcare, there's constantly laws that are changing. There's constant policies that affect what you're paying out of pocket, which is really scary. Hospitals I think, have a really long runway to get away with things with without a better way of saying that, but they just have acted with impunity for so long that they can overcharge, they can ignore. I've had one case where literally they were charging the patient $23,000 simply because they never got the explanation of benefits in the mail from their insurance company that said, no, this is the coverage that they should be receiving, just because they never got the facts. Like, people slip through the cracks all the time. And so I think it's really important to stay on top of all those changes. A lot of advocates specialize in finding the right insurance coverage for you. I would say that's not something that I specialize in, but I know a lot of advocates that do. And if you need help choosing a plan that fits your budget and fits your coverage needs, there are definitely advocates out there that can help you. And then, with prescriptions and things like that, a lot of us are very familiar with manufacturer coupons and different affordability plans and things like that. So if you can't afford your healthcare, an advocate is a really good option.
You said something which is really key earlier when you first were sharing about you and your journey and your business, is that you're board certified. And you had said something like some of the challenges that you face is that, people think it's a scam, or they're concerned, and they should want to they should do their due diligence. Absolutely. So I just wanted to bring that back up, because the key is that people like Emily are board certified, and you want to make sure that whoever, especially if you're being reached out to, that even if you're referred, that whoever you're talking with, you're doing your due diligence and you're finding out and doing your research. At the end of the day, that is key. But I do want everybody to know that these services are legit, they are available. And sometimes we just don't know. We don't know what we don't know. We don't know things are available. And it's up to us to go out and seek support. So if you're hearing this, please share with anybody that you know that might be going through some medical journey of their own, that this resource is available. Even if they feel they don't need it, at least they have the knowledge and the information that it's available. And we're going to share with you at the end how you can connect with Emily and learn more about these services. Emily, for you with this now your business, and you shared with us about patient advocacy, about what you do with your business. You've been in business for some years now. What have been some of the challenges when you first started moving into the business side and growth side of things? Because at the end of the day, in order to keep the doors open, we need to be generating clients, revenue. What have you done to get yourself known, to get visible, to be seen, and to attract your clients? Marketing visibility wise. And then on the flip side of the coin, what has worked for you? And then maybe some things like what hasn't worked for you as well as you had hoped it would.
Yeah. Great question. So 2025 was kind of a roller coaster for me. So my mission when I started out, my background's actually in international education. And I've worked in the refugee and immigrant space for a long time. So my goal was always to bring these services to that community. And so in Rhode Island, my services were billable to Medicaid under community health worker services. So providing people similar, not quite the same, but similar services who were on Medicaid, there was no cost to them, and I could bill the state. So that was really, really great. For about 2 years, I was growing and had a team of like 6 or 7. And we were doing great work. And then in May of last year, they cut that benefit entirely. So unfortunately, that was a huge blow to the revenue line and really had me shift in another direction, obviously. And so now I'm really focused on growing and building my private practice, and as well as getting these contracts with places like Umbra that take Medicare and helping them out. So it's been a journey. I think in terms of getting known, like I said, word of mouth is crucial because everyone I've helped is so relieved that they share testimonials that are really, really valuable. And then I always say I don't really have to spend a dime on marketing because as soon as people know this exists, so many people can find a use for it. So it's really about doing opportunities like this where I can have a chance to say, explain what we do and share the word that it does exist. And if you need it, to come find us. And then I'm also working on a lot of, content development and things like that. But we're also looking to expand into educational materials. And so instead of hiring an advocate, getting trained to advocate for yourself and learn how to take on some of these issues and tackle the system on your own end, which is really exciting. So that's kind of where we're headed next. And hopefully that'll be a different market. It'll be more B2B than B2C, but I think it'll be a really cool opportunity. And I think it's really important in today's day and age.
Yeah, absolutely. So if I could give you a magic wand and you can wave it over one challenge you're having right now, you shared last year that you could go poof and make disappear, what would it be and why?
I think the hardest thing is just getting a steady stream of referrals. So right now I'm in a really good streak, but it's just hard to know if that's going to continue. So making it a little bit more of a steady stream. That's my goal for this, Q1 and Q2 of this year, is working on that strategy. I am pulling in some AI capacity and working with some people to automate some processes and make the process of getting in touch with me smoother, and being able to follow up and things like that. So I'm pulling in couple different strategies, couple different tools. But if we had a magic wand and I knew I was going to be making X number of dollars every month, that would be really fantastic.
Yeah. Oh yeah, for sure.
And I'd love to get to the point where I had to hire, another advocate and expand in that sense, like get more people that we can help and get a bigger roster, but that would be down the line as well.
Yeah. So what's your big goals for this year, like 2026? What's next for you?
Yeah. So, like I said, I think expanding into the education space is something I'm really, really passionate about. I've done a lot of public health training in my background, and kind of using that and building a platform where people can learn the advocacy and take matters into their own hand. I think that's important for holding hospitals accountable, getting different groups empowered to help themselves. And then, like I said, streamlining the revenue, making this a viable moneymaker for the future.
Yeah.
Um, and yeah, potentially I have a really great program manager that manages all of our social media and everything, but expanding the team I think would be really great as well.
So for clinics and hospitals and
Hmm. Hmm.
organizations who are listening, what should they know about integrating advocacy services into their care models to improve their patient satisfaction, outcomes, and trust?
Yeah, there's some really interesting things going on. So, so one thing I've been thinking about is partnering with, different practices where we can help people when they get denied. Because if a patient gets denied by their insurance, the provider doesn't get paid either. So it does work hand in hand. And so providing these services to appeal these denials and get the money flowing where it should be going, I think is a really good opportunity to work with advocates. And then also there's other opportunities to work with advocates to get people the care they need. So like if you're a psychologist office, or a therapy or even physical therapy, things like that, people need other services to make sure that their healthcare is complete. And so working with an advocate to make sure, housing is stabilized, or they are getting the prescriptions filled outside of the office, or if you're a physical therapist and they need an orthopedist, then you can help them get the appointment set up and things like that. So, like I said, we go beyond the walls of any single office, and I think that's the really valuable part of what we do. And so those would be really great ways to work with advocacy as well.
So finally, for the people who may be hesitant to ask for help or they're unsure what a patient advocate could do for them, what's one piece of advice you'd give them about taking control of their own healthcare journey?
Oh, I love this question. Don't take no for an answer. My motto is the squeaky wheel gets the grease.
Mm.
And so continuously saying, but why? But, be like a 2-year-old.
Oh, I
Why is
love
that
that. Be like a 2-year-old. That's
Yeah,
great
why
advice.
is that the case? Why are you telling me this? I know that's the policy, but let's think about it like real people, real humans that don't actually have $20,000 in their pockets to spare, or $1.2 million in their pockets to spare. So let's think how we can go through this together logically like real humans. And I've found that that's a really effective strategy, like getting people to think as if this was their situation, putting them, empathy is a huge part of it. But yes, just don't take no for the answer. Never don't pay your first bill. That's a really kind of cliche aphorism. There's actually a great book called Don't Pay the First Bill by Marshall Allen, which is kind of the Bible. And just making sure that everything is correct before my parents just did this. They paid the first bill and I was like, so making sure everything is correct and right, and your insurance paid what you should. I mean, you're a valued member of their insurance. Your policy means that you should be covered and you should get what you deserve from your policy. So yeah, being a little bit stubborn, being a squeaky wheel, and encouraging empathy from the other side, I think would be two big pieces of advice.
Yeah, great advice, Emily. Great advice. So, how can people go reach out to you, connect with you, and learn more about you?
Yeah, so the best way is to go to my website, which is wheelhouse-health.com. And from there, there's a chat form that you can fill out. You can schedule a meeting with me. You can send me questions. But we are also on Instagram and LinkedIn, and you can follow. We do a lot of public health talk. We have a podcast as well called Voices in Health, and we just, tell stories of public health, people working and doing good work in this field. But yes, the best way is through my website, and I will look forward to hearing from some of you.
Well, make sure you reach out to Emily connect with her, because we all know somebody who's going through something, right? We all do. You might even be going through something and you didn't realize these services were available. And just think about if you were going through something and you know somebody that's going through something, and if you didn't know about it, they may not know about it. So please share this episode, whether you're watching us on YouTube or you're watching or listening to us on your favorite podcast platform. If you are, thank you. We're glad you're here with us. And second of all, please share this. This is really important information. I didn't know anything about this until I spoke with Emily today. I didn't even know this was available. And I know a lot of people are out there in the same boat. So don't pay that first bill. Key information that I didn't know either. So we're learning. We need people like Emily to share with us what we should be doing and not doing, and what we're entitled to, what is actually available for us. We don't have to, just because we get a bill or just because somebody says something, we don't have to take that as 100% fact.
Right.
And we don't know enough, right? Our insurance, we have so much paperwork. Most of us don't read it.
Some people, I've helped so many people through stacks and stacks of bills, and it's just so overwhelming. But your gut also will tell you. A lot of people come to me and they're like, I have a gut feeling that this is not correct. And that's when you should call an advocate, because that's when we can figure it out.
Well, make sure you connect with her, with Emily. Also share this episode so more people can learn about Emily and the advocacy services and these organizations, because like Emily said, there's different people with different specialties, but she's a great place to start because she can share with you if she can't handle it or doesn't, it's not that her space. She knows so many people personally in this space.
Absolutely.
It's a big network. She can direct you and refer you to, and it's going to come, her referral is going to be legit. You don't have to worry about whether they're certified or not. They're just going to be legit. Emily, before I let you go, and all of Emily's information is in our show notes. So if you're driving, don't worry about it, but it's wheelhouse-health.com. Wheelhouse-health.com. Make sure you go check her out and then find her on social, and we'll have all of her links inside the show notes. Before I let you go, Emily, is there anything that you'd like to share that I didn't get to ask you or we didn't talk about today?
I really appreciate the opportunity that you had me on. There's lots of really exciting work being done in advocacy. There's some incredible survivor stories that have turned into professional advocates. So like you said, if I can't help you, I'm connected to a ton of people who are really, really wonderful. And we're all here to help. So yeah, if you need anything, if you are stuck and frustrated and banging your head against the wall, that's when you need an advocate, and give us a call.
Yeah, you're going through a lot as it is. If you're the one dealing with a health issue,
exactly,
you're going through a lot. You can be going through fear. You could be going through a long time of treatment ahead of you, and you may feel like you're alone. Well, you're not, and you can get support in this area. So you like offload some of the stress by finding somebody that can handle this for you and who's in your corner, who's truly an advocate. That's why they're called advocates.
Exactly.
They're in their corner and willing to fight for you better than you can, because they know what the laws are. They know what the regulations are. They know what the codes are. They know how to get on lists that maybe you don't know how to get on. So like Emily has shared throughout the entire podcast, if you're up against a wall, if you feel like you're just stuck, that's the best way. If you feel like you're stuck, you're in the perfect spot, no matter what stage you're dealing with your health crisis or your health condition or whatever you're moving through, whether it's, even if it's not billing, but it's something else, and you just need to get to this next doctor or next step, reach out.
Absolutely. Absolutely.
Amazing. Thank you, Emily, because this has been so eye-opening for me. I had no idea.
Good. I'm glad.
So this has been a fantastic conversation. Thank you so much for being here
and
sharing your expertise with us. Thank you all for listening, and we look forward to seeing you on the next episode of the Business Growth Spotlights.